envers nous, grand Dieu d'amour. Merci pour la journée que tu permets de nous passer en bien. Merci pour le moment ça que nous pourrons passer dans l'étude, pour nous pourrons passer, pour nous apprendre tout, du cancer du sein. Nous demandons au Seigneur Dieu à participer avec nous, à là avec nous, à permettre que tout ça qu'a fait, qu'en harmonie à parole, et que tout petit tout qui l'a, ou bien qui sur les ondes, qu'a béni par tout ça qu'a fait. Nous te remercions de ce qu'on exaucé prière nous. Nous comptons sur nous prions dans nos Jésus qui vit et demeure au siècle des siècles. Amen.
Merci, ma soeur. We're gonna start. I want to thank Pastor Bernadette and Sister Bernadette and the whole church, and as well as the Temple Salem Health Department for giving me the opportunity to to do this program today, because I think it's really important. Welcome, my sister. We're doing a lot of things on Zoom, so welcome. Thank you. And I just wanted to introduce you in a panel discussion today, Sister Jeanette, who is one of my colleagues, and I believe she's in Dana-Farber. She's going to be with me. So this is the way that the program is going. I'm going to start first, and then she's going to really start second to discuss more of the screening aspect, which is very important. She has a lot of experience, especially in our culture. And then I would like to present to you the lovely Harriet Goodwin. She's one of my former patients, and she has some experience with breast disease.
Excusez, sorry.
Oh, sorry.
Je dis que les pitons me font traduire, je ne pas bon du tout non. Première fois m'a fait job ça,
donc
on va laisser.
I'm so sorry.
It's okay. Donc, Dr. Peggy t'a dit que Sœur Ginette l'a présenté avant, et puis après, Sœur Ginette pourra parler de diagnostic test, qui est très important, et puis après, il t'a présenté des amis que nous gagnons avec nous. Et c'est...
Oui, c'est Harriet Goodwin, c'est un jeune gérontologiste lié, puis c'est un former patient. She's my former patient, and she's had some exposure to breast disease. That's the first person, and then the second one is my... Oh, sorry. So sorry.
Donc, c'est Madame Harriet Goodwin qui était un patient Dr. Peggy pour un petit temps, qui c'est un gérontologiste.
Oui. And she has exposure to breast disease.
Il était exposition à cancer du sein.
And her friend also even had breast cancer.
Il y a des amis qui étaient cancer là aussi.
And then this is the lovely Pastor Idris Webb. We used to work together, and she's also was my pastor in my wedding too. So, sorry, Pastor Bernadette, that was my second wedding. So I asked Pastor Idris to help me with that. So anyway.
C'est Pastor Idris.
Okay.
Qui était un patient.
Well, she's the administrator at St. Joseph.
Oh, tu travailles avec lui.
Yeah, and she's also has her daughter that has been exposed to this disease.
Okay. Donc, Pasteur Idriss a une petite fille qui était exposée à cancer du sein.
So we're going to start very quickly. I just wanted to make sure. Oops, I hate when that happened. You know, I'm not just. I've been there. I do family medicine and geriatrics, so I am seeing all kinds of things. So I just wanted to put that out there. Okay, so let's start because we have a lot to cover. So basically, you said relevance. What are the factors? Screening, diagnosis, differential diagnosis, and treatment. Okay. So then the relevance, brothers and sisters, this is very important. The most common cause of cancer in women is breast cancer. I don't know if anybody, you can see it. Excellent. So not only that is the most common, but it's the second leading cause. So it comes after lung cancer.
Donc, cancer du sein, c'est une qui est plus commun pour filles. Il vient après
Cancer du poumon.
cancer poumon.
Oui. And then 1 out of 8 women die from this problem. And one out of 8 women has breast cancer, and 1 out of 30 women would die from that.
Yon nan 8 moun gen cancer du sein, yon nan 8 filles, et yon nan 30 mouri cancer du sein.
Oui. But not since we have brothers in this in this community too with us, 1% of men can suffer from breast cancer also.
Monsieur autour qui a un cancer du sein, 1% de monsieur qui a un cancer du sein.
Okay, so what is the driving message for you guys today is this: we can do something about it. Early detection and follow up with your doctor is key.
Ça nous a sorti avec les jodi, c'est que nous avons fait une différence avec ça, détection très tôt, qui a aidé, et puis pour nous suivre, tests que nous avons pour nous faire avec le docteur. Yeah.
And you know, basically the bottom line too, if you have high risk factors, they have medication now. You know, if you have genetic issues, we can test them. If your family has it, I know in our family, in this culture, well, it's not just our culture, in all the cultures I'm finding out, we don't talk about our disease. When they do family histories, brothers and sisters that are listening to me, talk about this thing. You don't have to hide anything. If we don't know, if the doctor doesn't know, we cannot do anything about it. So,
il est important pour partager l'histoire famille avec le docteur parce que génétiquement, il y a une tendance pour une maladie et un remède pour ça qui a aidé.
Okay. So I was talking to Mrs. Goodwin earlier. You know, there's something called fibrocystic disease, but there's also a combination of cystic disease with solid mass. And then if you have the combination, so now I'm in risk factors, if you have a combination of those two, that will lead to breast cancer. So if you just have cyst, no cancer, cyst and mass, equal cancer. And you can, okay, sorry, that's important, that one.
Oui, l'organe 6 pour contre l'île, pas nécessairement veut dire cancer, mais l'organe 6 ou gain en masse, qui vient égal à cancer.
Merci. Age more than 50 and radiation, that there are certain cancers, Hodgkin disease. You get radiation therapy, you're committed to cancer. So that is one of the risk factors that is very important.
Oui, le conseil de maladie, l'organe est exposé à radiation, donc ça vient mener à cancer, tant que Hodgkin disease.
Yes. And then high socioeconomic status, I'm not going to get into that. First child, if your first child were born after the age of 20, that's a problem. There's not enough protection. So I think that's what they're saying about that. And then history of breast cancer. If you have a first-degree relative, what is first-degree relative of breast cancer? Your mom, your sister, your aunt. If they've had breast cancer, you are committed to breast cancer. You have to go and tell people, your doctor, about those histories, so that way they can do early detection. Please.
Donc, il y a un bon facteur qui prédispose pour un cancer. Là-dedans, si vous avez 50 ans ou plus, can you go back?
Oh, sorry.
No? Yes. Si vous êtes exposé à la radiation, si vous avez fait premier petit ou après 20 ans, si vous avez une histoire de cancer dans la famille, surtout si mon est proche, tant que maman, ma tante,
sister,
premier cousin.
Yeah. And then one of the things that I really don't want to get into is obesity, but you can see when you're overweight, BMI more than 30.
Obèse météo à risque aussi.
Yeah, obèse météo nan l'en fait nan pile bagay. So faites attention avec ça, s'il te plaît. I'm not going to get into these because those are not. So basically, the key message that I want to bring out here is that the Adventist diet is very important. So follow the Adventist diet is a vegetarian diet, low-fat diet, vegetables. It's very important. It's a protection too against breast cancer.
Point important, docteur voulait montrer, c'est que diète adventiste là très important parce que l'on fait on diète végétarienne, liée pour fight pour combattre maladie.
And then the next thing that is important is the mutation. We're going to get into that. There are two mutations now that we know about, the BRCA1 and 2. If you're exposed to that, if you were tested with that, that will lead to breast cancer. Okay. So what about these BRCA genes? If there's about it's about one out of 300 to 1 out of 500 of people that are exposed to this. That BRCA genes, 1 and 2, it doesn't matter which one, it has a high level to exposure for you to develop breast cancer. Very important. S'il te plaît.
Gon gène qui les BRCA,
Oui.
1 ou 2, quel que soit une ou deux, yon sous 500 moun exposés à maladie ça.
Okay.
Gène ça.
Yeah, the other thing besides the BRCA is family history of breast cancer, ovarian cancer, tubal cancer in your tube. If it is in your stomach, if you're exposed to that, tell your doctor so that way they can do counseling with you. When they do the counseling, they can check about the BRCA genes and then you can get early treatment.
Donc c'est pas histoire cancer du sein seulement qui est important, si vous avez ovaire, si vous avez une famille qui a cancer ovaire ou bien dans tube ou bien utérien. Fait docteur connaît pour vous faire examen pour voir si vous avez un gène ça qui BRCA 1 ou 2.
Oui, merci. Okay, and then I know this is a little bit maybe too much, but when they find this thing, if you already have a lot of babies, I don't know what a lot of babies may be. For you, it may be 1, but for some people, maybe 6 or whatever it is. So, but they can remove your ovary, and they can do mastectomy. So this is like something new, radical. We are doing that now, and that is a good protection. Very important.
Le rejoindre gène ça dans vous même, vous doit faire une opération qui pour retirer sein yo, tailler les mastectomies.
Oui, et puis retirer ovaire.
Retirer ovaire tout pour protéger.
Yes, exactly. Okay, so then when do we screen for these people and how do we do that? To get, at what time, at what, how would I say, when do we start it to check for these things? We can do it monthly, breast self-exam. You see, if you have family history of this, you can even start at the age of 21 to do monthly breast exam.
Donc, qui est qui est bon pour commencer à faire check ça yo? Ou qu'à commencer à partir de 21 ans?
Breast self-exam.
Ou checker sein ou même pour contour?
And then the clinical breast exam, Dr. Agenwafeli, chaque 6 they can do it every 6 to 12 months.
Donc, l'on fait pour contour, c'est chaque mois, pour faire le contour.
At the
Mais
age of
docteur ou l'on docteur, chaque 6 mois ou bien 1 an, docteur en fait le pour.
Yeah, and then you see the ages 25 to 35. And annual mammogram, starting age 25 to 35, and then the ovarian cancer screening, you can see it there too every 6 to 12 months. But this is special occasion. Those are for people that you think that they may expose to those genes.
Donc ça c'est pour monde qui a une chance pour yo gain gène ça yo. Donc ou ka commencer avec testing checker pour contrôle bien avec docteur. Checker pour contrôle à 21 ans avec docteur de 25 à 35 ans et puis vous faire mammogramme régulièrement annuellement entre 25 à 35 ans.
And the key thing is the age, because why is that important? The U.S. Preventive Task Force, this is the guidelines that we have. They say 40 to 49 in those patients that are at risk. But you can see those patients, that for some of those patients, we start a little bit early. So it's been revised constantly.
L'âge là très important parce que Yo dit que entre 40 à 49 ans, mais nous voyons que y a une présence maladie un peu plus tôt, donc yo commencé un peu plus tôt.
Yeah. So now, if you're 50 to 74, no, I don't want to hear it. All of you need to go and get a mammogram.
Entre 50 à 74 ans, tout le monde supposé prendre faire mammogramme
Chaque-
annuellement,
I mean, every 2 years.
chaque 2 ans.
Okay? So, and then after the age of 74, I don't care anymore unless you've had breast cancer, you've had radiation therapy, you've had something that it puts you at risk. Very important.
Après 74 ans, pas besoin de faire encore, sauf si vous avez gagné cancer là, ou bien vous êtes exposé à radiation.
Okay, so I'm not going to say too much about this. The other thing is, some people are saying to me, why the hell am I going to do a breast MRI? Okay, so those patients that has this BRCA genes business that are at high risk, sometimes in a mammogram, a plain mammogram, you cannot see it. And the patient said to you that, doctor, I can feel something. So the most sensitive test for those patients is the MRI.
Moun qui gen tendance, moun qui gen gène nan que vous parlez de BRCA, des fois mammogramme n'a pas montré vraiment. Donc vous obligé de faire un test qui est plus sensible qui est les MRI.
Yeah, merci. Okay, so that's all we're going to say about that. Okay, making the diagnosis, how do we make it? You feel a lump, you tell us. That's all I'm going to say about that. That's number one, okay?
Pour diagnostiquer, qui j'en fait, de pour sentir un bagay dans sein, yo fait
Yeah.
plus test.
You have pain, you tell us. You have
Si
swelling, you tell
docteur
us.
de pour gain douleur ou sentir un bagay ou gain inflammation, quelque chose soit senti qui est anormal, fait docteur connaît.
Yeah. And then sometimes too, your nipples can give you, can spill stuff. Like,
Des fois, on doit gagner des charges dans mamelon.
yeah, and you're not pregnant, you know.
Et autant qu'on monde qui a allaité, mais il est là, donc ça sont bagages qui sont signes
Yeah,
anormal.
exactly. And it's also in men. And you have to be careful. There's certain medications that can predispose you to that. The antipsychotic medication, for those of you that see your young male, they could be doing marijuana, or they could be taking their antipsychotic medication and they're ejecting those discharge. Be careful. And then those of us that are taking blood pressure medications and heart medications, also, they can eject those things from the nipple.
OK. Donc, il y a un médicament qui a créé des choses, mais ce n'est pas nécessairement cancer. Donc, il y a son médicament antipsychotique, il y a droit pour hypertension. Qui l'autre maladie?
Oh, antipsychotic, hypertension, those are the key,
Okay.
yeah, those are the key things. And heart medications like amiodarone and digoxin can cause lactation too. Okay. Okay, so making the diagnosis and differential diagnosis, lump, mass, tell the doctor. Okay.
De pour gagner en boule ou sentir n'importe bagay, dit docteur.
Inflammation, swelling, pain, fever. It could be what is called a mastitis. Okay, tell the doctor.
Inflammation, la fièvre, n'importe bagay ça ou gen doit c'est ça les mastitis.
Yeah, and then you know, also too, there are certain kids that are less than 30 years of age and stuff like that. They could have have pain with the breast when they have their menstruation. Okay, if you're under stress, you can get pain in that. And then for men, a lot of men also get gynecomastia and stuff like that. So that's not good. That's sort of part of the differential diagnosis.
Donc, on n'est pas supposé courir casser tête si vous avez une douleur, parce qu'il doit y avoir l'autre qui cause douleur. Donc, si vous sont monde qui stressé, ou avez une période où vous avez une possibilité pour gagner douleur dans ces tout.
Okay. And then there's something called Paget's disease. We'll get to that later. So you can see the breast mass, okay? You have, if it is solid, okay, that's not good. Benign mass can be solid or cystic, okay? You can tell them that for me.
Si masse béni, li gen doigt solide ou bien gen doigt son 6 lié.
So because of that, I put the differential. You can see the benign, it could be a cyst, it can be a mass like an adenoma, it could be milk lactation, it could be just fat. And then malignant, it's not good. That one is a big mass and it's in different part of the breast. Okay, so the evaluations, I'm not gonna get too much into it, but basically we look at the whole breast, and then we look at the size of the mass also, and then we look at for node, like how do I say it? Anyway, node that are in
the lymph node.
Yeah, the lymph node that are underneath your breast, in your clavicle area. We look at that because that will tell us how aggressive we need to be in our treatment.
Donc, le fait évaluation, c'est pas un sein seulement regarder tout autour de sein. Donc, comparer deux seins et puis ou prend information dans node lymph.
Okay, I apologize for this slide, but basically what I wanted to see about this slide, you cannot see it. Typically, a young person, less than 40, we start with a sonogram. Because typically in those patients, we're going to see a cyst, or it could be a mixed cyst. But if somebody that is more than 40, we start with a mammogram. And then if we're not so sure about what's going on, maybe I should stop there. Let me just, less than 40, or ultrasound.
L'homme qui a moins de 40 ans, vous fait un ultrasound. L'homme qui a plus que 40 ans, là ça vous fait mammogramme.
Exactly. And then if it is unequivocal, you're not sure what's going on, you may have to go and do you will go and get a biopsy. And then a biopsy would delineate exactly what it is. You know, is it a cyst or a solid mass that could be cancer?
Donc, comme si il y a une question qui ça le doyer, après l'examen ça yo ka vinn faire une biopsie, qui vinn déterminer si son 6 ou bien si il y a un cancer, cellule cancer là-dedans.
Okay. So the second slide that I showed before is basically another way of looking at it. This is the pathogenesis of the breast. When I saw this thing, I missed the diagnosis. Please, if this thing doesn't go away, this is not a rash. This is really, I thought it was a rash when I saw that. But then feel the breast. Tell your doctor, you know, you feel something that is abnormal. Yellow, well, you guys can see it. That's not good because that is predisposing you to cancer. So.
Imagine regarder, c'est pas un rash, donc li doit paraître jaune ou bien jaune ou là, fait docteur nous connaît.
Okay, so let's get to the bottom. And the next thing, I'm sorry. Oh, I'm doing two things at the same time. Okay. I apologize. Okay, so then, bottom line is, you are committed to, let's say that you develop breast cancer. I'm sorry that this is not so clear. This is a hot ticket item in August 2021, WFP, American Family Physician, bring that up. What I'm saying, breast cancer is revolutionary because now, okay, if it is localized, if it is just in the breast, they can remove it. If they see a lump, it's just a particular area, they can remove it. But if it's all over, they can do a mastectomy. If it is class 2, 1 to 3, okay, what I'm talking about is the stages of the breast. When you do the mammogram and the biopsy, they can see exactly how involved it is.
Okay. Donc, docteur, excusez-moi de ce que l'image n'est pas trop claire, mais il t'a expliqué que si justement son masse seulement qui n'en sait, il doit retirer. Mais oui. S'il y a gaillé plus.
Oui, le gaillé plus. I mean, when he spread plus. When he spread more, now you are in stage 1, 2, 3, and stuff like that.
Le gaillé à l'autre côté, donc il doit venir mettre stage là 1 ou bien 2.
Okay, so now you're committed not just to lumpectomy or mastectomy. Now we have other stuff like hormonal therapy that we can do, chemotherapy that we can do. So if you don't go there, if you don't tell us, we cannot do. You should not get I should not get to somebody should not come to me nowadays with a stage 4. A stage 4, it spread all over the place. It spreads. Okay, go ahead.
Stage 1 à 2 ans, le ça yo ka fait un bagay médicalement yo ka fait un bagay yo gen doit faire radio chimiothérapie ou bien l'autre traitement mais l'arrivée au-delà de 1 à 2 ans c'est devient plus difficile.
Excusez, je m'explique ça c'est très important.
OK.
Dans stage 0-1, il était dans séance même, dans séance même di collé. Moun sa yo retire morceau dans séance ou bien yo retire toute séance. L'arrivée dans stage 1, 2 à 3, ça veut dire que ça que c'est pas seulement dans séance mais il y a ça que les lymph nodes je vais dire en créole mais qui bagay vasculaire qui était en bas poignette là ou bien les bas côté clavicule là ben ça moun sa yo non seulement au fait retirer sein gen l'autre médicament que capable bailler chimiothérapie que capable bailler l'arrivé dans stage 4 là il aller tout côté là il aller dans brain l'aller dans poumon l'aller dans os que la même il peut ba ou toute qualité médicament pour lui. Okay, so in other words, stage 4 is deadly. We should not get to stage 4 if we go and do regular checkup, early detection. That is very, very, very important. Okay.
L'arrivée dans stage 4 là ou ka mourir donc ou pas supposé essayer ou est pas arriver dans partie ça donc parler bonheur avec docteur.
Okay. So no, I'm done because I want to give my sister some time too. Those are my references. Please, you can look at U.S. Preventive Task Force in the online. I'm sorry, Sister Chantal, just tell them to. Okay, I'll just finish it then. Thank you. Okay. Okay, so U.S. Preventive Task Force là est très important. Au cas regarder online. Okay, ça c'est chez moi. Okay. Moi, je remercie Temple de Salem pour l'opportunité à nous toutes. Ça est très, très important. Merci. Avec vous, qui est là, c'est Sœur Ginette. Excuse-moi, Sœur Ginette. Merci.
I thank you, Dr. Peggy, for the opportunity. I'm not going to say much. Good afternoon, everyone. Dr. Peggy have already covered most of it, but I need to talk about racial disparities because racial disparities play a big role in breast cancer. You can say that breast cancer is a disease that is diagnosed more by white women, but more black women are dying of the disease. Everybody will be able to understand, so I don't need to. Will be able to or translate for me. I don't.
Sorry, go ahead.
So you go in English?
No. Go ahead, keep going.
Okay. Yeah.
I'll do my best. Do whatever language.
Yeah, we want to talk a little bit, I start over, about racial disparities because racial disparities plays a big role in breast cancer. Studies show that more white women are diagnosed with breast cancer.
Donc, une étude qui montre qu'il y a plus de filles blanches qui ont un cancer du sein.
While more black women are dying from the disease.
Mais il y a plus de filles noires qui mourent de cancer du sein.
The reason is like early detection remains the key for breast cancer.
Donc ça vient prouver que plus bonheur nous prend maladie, nous avons plus de chances pour nous survivre.
We not educate black women and especially Asian women. We're not so much educated about educated about breast cancer. We didn't know much about it. Therefore, there are a lot of people who die with the disease because they catch the disease so late that they cannot survive.
Malheureusement, pile dans nous-mêmes noirs, nous mourons avec maladie parce que nous pas éduqués sur qui gens pour nous détecter signes bonheur et prendre bonheur. Donc, en pile dans nous mourons avec maladie.
So even the white women, especially Caucasian, they are educated about the disease. They know when to do their mammograms. They know when to do their breast self-exam. They know when to do their clinical exam. So if there is a lump, it is easier to detect and easier to treat.
Blanche yo éduqué sous maladie, donc leur gain yon signe, yo agi rapidement, et therefore ça va avoir plus chance pour yo combattre maladie.
I work in the community as a public health advocate for breast cancer. I do a lot of outreach, a lot of education, especially for Haitian women.
Je travaille dans la communauté et je fais un peu d'éducation, spécialement à femmes haïtiennes.
There was a woman who came to my workshop and she was explained that she is alive because she is here in America. All her family members die in Haiti with breast cancer. Even men in her family die with breast cancer.
Donc, on travaille ou croisé avec une femme haïtienne qui dit que toute famille, quand pile monde dans famille qui mourit avec cancer du sein, même monsieur, même un peu garçon tout, mais comme li vini boy ici, c'est ça qui sauve.
So mammogram, we don't want to ignore mammogram. Every year, that should be done.
Mammogramme, tu vous faire chaque année.
At the age of 40.
À partir de 40 ans.
However, if you have your mother who died with breast cancer at the age of 45, when you go to the doctor, it is important to explain that because at the age of 35, this is called diagnosis by age. At the age of 35, 10 years apart, you don't want to wait to be 40 to get the first mammogram.
Mais si maman est mourie à l'âge de 45 ans, par exemple, ou pas besoin de temps ou bien 40 ans, ou supposé commencer à faire mammogramme, dit docteur ça, il a commencé à faire mammogramme à partir de 35 ans.
This is called age-up diagnostic. It may not apply to everybody.
Age diagnostic?
Age-up diagnostic, this is how they call it.
Can translate that. Go ahead.
Yes.
On diagnostique à partir de l'âge.
Family story, per
Yes.
se. We were also talking about when to do the exam. We do the mammogram, again, at the age of 40, but breast self-exam, as Dr. Peggy just said, we need to start it at the age of 20.
Donc, checker ou même non, là, on checker c'est un pour compte à partir de
Age of 20.
à partir de 20 ans.
Okay. And this exam is done 5 to 7 days after your period.
Fait examen ça 5 à 7 jours après ou gain période.
This is when the breasts are very tender and soft.
Là ça c'est un genre plus souple.
And then you can do it in your shower while you're bathing.
Pendant un bain ou gain doit faire li.
And if there is a lump, you will be able to feel it. But don't do it before you get your period, because as women, we know that our breasts get a little bit bumpy before the menstruation. So it is important to do it after the period and between, as I said, 5 to 7 days.
C'est très important pour faire test ça, checker c'est un pour compte après période ou pas avant, entre 5 à 7 jours après période.
And for women after menopause, still choose a date in the month and do it anyway.
Même après ménopause, vous pouvez toujours checker, choisir un jour dans le mois
it is important. And those are the things that I wanted to say. There are many ways we can prevent breast cancer.
Gan pile façon nou ka fè prévention.
Besides those exams and tests, losing weight,
À part de examen ça ou de test ça ou gen l'autre bagay nou ka fè, nou ka perdre du poids.
because study explains that there is a relation between fat, the circulation of fat in your body, and breast cancer.
Étude montré que gen une relation entre graisse qui circule dans le sang et cancer du sein.
And also losing weight, eating a diet that is rich in vegetables, in fruits, especially yellow vegetables like jumu or squash, if you want.
Perdre du poids avec une diète qui est riche en légumes, spécialement ça qui est jaune, tant que jumu.
And the yellow potato, there's the
Pomme de terre qui est jaune.
sweet potato.
Okay. Pomme de terre douce.
Yeah, sweet potato. Those things help you to lose weight.
By ça ouais do perdre du poids.
And also it is important to drink a lot of water,
Boire un pile de l'eau,
exercise,
faire exercice.
and when you do prevention for breast cancer, you also do prevention for a lot of diseases.
L'on fait prévention pour cancer du sein ou aider tête ou pour un pile l'autre maladie.
And a lot of cancer,
Un pile l'autre cancer.
and including cancer of the colon.
Inclut cancer du côlon.
And what I was going to say is like, if you exercise, you drink water, you maintain a good diet, that doesn't mean you won't have breast cancer, but you'll be, at less risk.
Si vous faites tout bagay ça yo, fait exercice ou gon bon diète, ça va veut dire que pas gen maladie mais li met en risque ou gen moins risque pour gen maladie.
And speaking about risk, Dr. Peggy was going about all the risk factors for breast cancer. Having the risk doesn't mean that you will have the disease, because all women are at risk. This is something that we have to put in mind, that as long as you are a woman, you are at risk for breast cancer.
Depuis c'est fille ou gen risque pour gen cancer du sein. Lo gen risque là ça va veut dire automatiquement ap gen.
So the REACH program 2010, which is this brochure that was developed by the Boston Public Health Commission, we used to work and disseminate this brochure everywhere, encourage women to participate in activities about breast cancer. It works. Now, the number of women in Massachusetts who die of breast cancer is decreasing. That was done by the Boston Public Health Commission. We developed this brochure.
Thank you so much. Brockton Public Health développé en
Boston Public Health Commission.
Yeah, développé un programme
Yes,
qui aide
they
à
have a
pile
program.
qui aide.
Encourage them to do exam, to talk to the doctor. Sometimes they call them, and we had case managers also in that program. Sometimes the doctor tell you to come back to do another test because there was something suspicious. They don't come back. And that's when it was difficult to be treated. That's where that program had a case manager that call you, that make sure that you go if they call you. Because once the doctor call you to come back for another mammogram, that's when they have seen something that's to get attention to.
Donc programme ça gen case manager, gen docteur, puis moun sa yo connecté yo relé patient yo pour yo retourner à faire l'autre test. Tant que soute font mammogramme, yo relé encore pour retourner vinn répéter mammogramme nan, font aller mais en pile nan moun yo pas retourner.
And that's when it's very dangerous.
Et le ça est très dangereux.
And there was the van in the community that we used to work in that van. And the Boston Public Health, which 2010, wasn't working by themselves only. We were connected with all the hospitals in Boston, like Brigham and Women Hospital, Boston Medical Center, and Mass General Hospital.
Te gon ven qui t'a circulé dans la communauté, qui t'est connecté avec un pile gros l'hôpital, Boston Hospital, Mass General.
So we refer patients for mammogram. So we want to make sure they have their mammogram done.
Donc, vous pouvez encourager mon yo pour yo continuer faire mammogram yo.
And as I said, it works and it's a fight. It is a fight for women, so it is a fight. When there is a fight for women, men are also in the fight. So we all are fighting for breast cancer.
Yes. Donc c'est un combat pour mesdames yo. Donc si on combat pour mesdames yo, monsieur yo là dedans tout, so nous toutes n'a combattre disease ça.
Okay, thank you for the time.
Merci pour ton temps.
Thank you very much. You can join us. Thank you. I would, yeah, thank you. Mrs. Goodwin, and now this is your turn. You're in the hot seat. We wanted to hear from you, giving your past history with breast disease. Oh, I'm sorry.
Sorry, my hands aren't working very well. I don't have any breast problems, but right now, my hands are.
You know, I just wanted to say something. This woman is very special. She just had surgery in her hand, and she's willing, she's dedicated, committed to this project.
Dame ça, son dame qui est très spéciale, il fait que fait opération dans Meni, malgré ça, il vini.
Yeah.
Well, I'm here to speak in a very different vein than the technical vein, where we've been all lectured this all our lives, I'm sure I have. And I'm in my 80s, so I've been around a long time with breast cancer. Starting before mammograms, before medication, before anything other than people dying. And the first experience I had as a young woman was my sister-in-law, who had 2 little boys and who had what they thought was mastitis. And she lived up in northern Maine, and she went to the doctor, and they were treating her for feeling that it was related to the birth of her last child. Well, it wasn't. And she ended up, oh, I'm sorry, you want to interpret. Sorry.
I'm sure I'm going to miss a couple things, but please help me out.
Abbreviate.
So, Madame Henriette, li nan 80 ni, li dit que li gan pile année li exposé à cancer du sein, mais li ou an pile monde mouri. Donc c'est
My sister-in-law.
your sister-in-law after the first birth.
Second birth.
Belle-sœur li après deuxième petite li te détecté anomalie dans sein ni. Go ahead.
So we talk about making people aware. I can assure you that made me aware of breast cancer. And she ended up down here at Mass General, where she got wonderful care and wonderful treatment, but radiation was the only thing they had, which was a pretty harsh treatment, and she would come and stay with us for the duration of her treatments.
Donc, en belle-sœur était ma générale, vini pour traitement, et à l'époque, c'est radiation seulement au te gain.
See, I'm so glad you mentioned that, Mrs. Goodwin. So you can see, like I was saying from the report, now we have so much more. So there's no reason to die. There's a hormonal therapy, there's a chemotherapy, there's a radiation therapy. So there's so much that can be done.
Qu'on y a gain beaucoup plus que radiation, so pas gain. Si mon yo suive, y a pas mourir.
And exactly, because as we move on in my life over the years, my very dearest friend had breast cancer. Some 20 years after my sister-in-law, and times had changed. She was at Dana-Farber. Everything that was new was there. She had chemotherapy. They didn't think she'd live very long. She lived 22 years and had wonderful treatment, wonderful care, and so we move on.
Bagay yo changé un peu. Parce que le devine gon zanmen qui gagne cancer du sein, qu'on a gagne chimiothérapie, il était suivi dans Li vive 22 ans après diagnostic là.
I'm a quick learner. I mean, having had lost two people very dear to me, I was very conscientious about my mammograms. And lo and behold, they found a mass.
Donc avec deux monde très chers à lui même que il était perdu, il était prêté en pile attention à signaux, il était fait mammogramme régulièrement et il vinn ouais en masse.
And I flew to Dana-Farber.
So il courit là le Dana-Farber.
And I had surgery, and it was benign.
Il fait opération et il pas de cancéreux.
No cancer. So I was one of the fortunate ones, but who knew? I mean, it was not.
Donc il était grand pile chance.
It was not a mass that you could feel. It was inside, and if I hadn't gone and it had been cancer, I would not be talking to you today.
Donc masse ça c'est pour bagay li te ka li même pour louer li, le t'a fait test pa li. Donc s'il pas fait mammogramme nan, li yo pas t'a jam connaît.
And the progress went on. Some years later, a very dear friend of mine had breast cancer. She has had the treatment over the years. I think she's probably 20 years out now. She's doing fine. She's working. She's in her 70s. Everything's fine. There's been no recurrence. There's been no further problems.
Et en pile temps passé, il devine gon l'autre zamine qui gagne un cancer du sein et zami ça a fait plus que 20 ans qu'on est allé dans 70 ans, la vivre toujours.
So that's kind of my message is, you know, we're at a point in life where these things can be treated and treated successfully and quickly to everybody's advantage. So don't put off your exams. Don't put off your mammograms, annoying as they are, but until you're my age, then you can put them off. You don't have to worry anymore.
Donc, tes messages, ça, li te vle passer, pas passer sous ça, pas dormir sous ça, faire mammogramme nous à l'heure, parce que c'est la meilleure façon pour détecter si nous avons une maladie et faire traitement.
And one of the reasons that I did this presentation this way is I'm a gerontologist, and I was also involved in a lot of lobbying for old people, which I love to do. And we had a favorite saying there. We used to say, put a face on it. Don't just talk about the disease and the treatment and the symptoms, and put a face. So tell me something about it. So now you have some faces along with me.
Une raison que li fait li venir là, c'est parce que dans tout travail qu'on a fait promulguer maladie, parler de maladie, yo dit li comme ça mettait en figure sous ça l'a dit yo. Donc li venir là pour parler plus de ça pour faire tout le monde how do you say awareness. Ok, réveiller tout le monde pour. Ok, thank you. I should switch the languages at this point. Donc, il est là pour le motiver, nous. It's okay, it's okay.
So thank you very much. I love being here.
Merci un pile, je suis content de là avec nous aujourd'hui.
Thank you, Mrs. Goodwin. Now we have the lovely Pastor Idris that is going to tell her story.
The lovely pastor is going to tell her story.
The lovely pastor. Notre bien-aimé pasteur, Idris.
Good afternoon, and thank you for having me, Dr. Mentor.
Bonsoir, merci de m'avoir ici.
It's a pleasure. My story, I have had some scares. So after my first baby, about a year later, I was doing breast examination.
Donc après premier petit moi, m'tapé à peu près 1 année après premier petit moi, m'tap checké sein moi.
And I found some lumps.
Et puis moi détecté quelques masses.
And I had surgery, but it turned out it was mastitis. You talked about
Il
that.
fait opération, mais il pas cancéreux.
And that kind of plagued me later, because a few years later, I was doing breast examination.
Quelques années plus tard, il t'a checké sein encore.
And I found more than one lump.
Il
It's a
joue
bunch of
plusieurs
lumps.
lampes.
And so I went to the doctors, of course,
L'alka docteur.
and I had a biopsy done, and they found out that, you know, it was benign.
Yo fait biopsie ouais que il était benign.
The funny thing is, I saw the surgeon, and she said, well, you know, it's mastitis, blah, 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 and you can live with these. I mean, they're not stationary, they're running around, so it's okay, you can live with them.
Chirurgien pas tellement gen que sauter, il dit qu'à vivre avec lui.
But if you know me, I'm like, no, I wasn't born with these. Never felt that before. So no, I am going to have the surgery,
Donc
which
il
I
dit
did.
docteur que il pas fait avec yo, il voulait le retirer yo.
Yeah, so I did have the surgery. And funny, she was worried, she was more worried about my scar than I was. Because she said, do you know you're going to end up with a scar on your breast?
Docteur a ton gens gen plus problème pour passer que il t'a inquiété que le ka gen une cicatrice dans sein.
And I said to her, well, I'm married, and, you know, I mean, if he can't live with me with a scar on the breast, well, then, so, doesn't matter, I'm doing the surgery. So I did.
Il dit docteur li marié
Yeah.
si marié pas t'a vivre avec cicatrice là sans problème donc il fait opération.
So this month is Breast Cancer Awareness Month.
Moi ça c'est pour motiver tout le monde sur le cancer du sein.
And for the entire month of October, I have dedicated my television show to breast cancer awareness.
Pour tout mois octobre là, il dédicacé un show télévisé le gain pour cancer du sein.
So now they're calling it BAM, Breast Health Awareness Month.
Oh.
So they're putting a positive spin on it. Instead of saying Breast Cancer Awareness Month, it's Breast Health Awareness Month.
Oh, tout n'a yo changé li pour BAM, B-H-A-M. So santé sein, c'est pas nécessairement cancer, but pour focus pour sein en santé.
So today I had a young lady on who is a 2-time breast cancer survivor.
Oh, t'es une jeune fille jodi qui a cancer 2 fois.
And as Dr. Mentor mentioned, early detection saves lives. And the only reason this young lady is alive today is because she did her mammogram. She would have been gone both times.
Elle dit comme docteur Mentor dit, détecter bonheur, c'est ça qui a sauvé nous. Seule raison que fait jeune fille ça là toujours, c'est parce que elle était fait mammogramme ni bonheur.
And breast cancer is really, really dear to my heart.
Cancer du sein son bagay qui affecte li en pile, qui est très
Because my oldest daughter was diagnosed a year ago with breast
oh,
cancer.
premier petite fille était diagnostiquée l'année dernière du cancer du sein.
And again, it was early detection that saved her life.
Encore une fois, c'est parce qu'elle était détecté bonheur qui sauvait la ville.
So she's doing well, thank God.
Li bien, grâce à Dieu.
Caught it at the time that she didn't have to do radiation, or it was zero. So
Dans stage li était zéro, li prend en l'heure qu'elle peut obligé faire radiation.
so she, you know, she didn't have to do radiation or chemotherapy, thank God. So, you know, I speak from a place of, you know, it's really, really here.
Son bagay qui est très cher à lui-même, tout ça l'a dire.
And that's why this month, the entire month, is dedicated to breast cancer awareness. It's on my show. And you, my dear, you will be interviewed. You just don't know it yet.
Donc, il a invité Dr. Mentor pour venir dans le show, hein, là, pour l'interviewer.
Yes. So that's my story.
Donc, c'est histoire par moi.
Thank you, Pastor Idris. I repeat, for those of you that are listening and on the website everywhere, early detection. What is early detection? 40 to 49, you do it. If you have risk factors, you do it. And you may have to do it a little bit earlier. Genevieve say 10 years earlier, if your mom, your sister, your aunt had a diagnosis at the age of 45, you need to do it 10 years before that. For the normal average people, the U.S. Preventive Task Force that, we're not just doing things by, without any guidelines. The doctors look at the U.S. Preventive Task Force for the normal people, the average people, between 50 to 74, you're committed either once a year, twice, every 1 to 2 years. And breast exam is mammogram is very difficult, so it's painful. So if you want to do it every 2 years, it's fine, but every 1 to 2 years, and it stops at 74 unless you've had problem cancer. Thank you.
I'll try. Donc, Dr. Peggy fait nous songer que détecter bonheur très, 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 très important. Et comme Dr. You doctor for me right now, this second. Comme Sœur Ginette dit, nous, même leur famille qui a une maladie, ils ont poussé le poupi devant 10 ans plus tôt. Donc, commencer à 35 ans au lieu de 40 ans. Ou bien, puis bonheur toujours, ça dépend, parce que le docteur a un guide qui pour montrer qui ça peut faire, dépend de l'histoire que vous avez. Did I cover everything?
You got it. Thank you very much. So the floor is open for you guys. If anybody has any questions, feel free to say something.
Donc, je dis, si nous même là, un monde qui sur les ondes, si vous avez une question, nous avons texte 617 291 57 14, ou bien nous même qui là, le moment c'est pour nous si nous avons une question.
Est-ce que l'organe douleur dans le sein, ça veut dire c'est un problème automatiquement ou gain?
Très bonne question. Non, l'organe douleur dans le sein, il est capable n'importe bagaille. Moi, je dis, comme si on soit de differential diagnosis. I give a differential diagnosis. Pain in the breast could be a mass, it could be a cyst, it could be an infection like mastocytitis, and it could also be cancer. That's the reason. C'est raison ça à cause du fait que les gens ont n'importe bagaille, infection, cancer, cyste, les gens ont même son lettre qui descend dans bagaille dans tétéo bail ça yo. Il est très important pour aller ouais docteur. Aller voir docteur a examiné et puis d'aller examiner l'a checker pour voir est-ce que ça a des mérités pour faire un sonogramme ou mammogramme dépendant de âge. So in other words, it's very important to go to see the doctors because it could be anything that we already that I've mentioned before. Plain pain, it could just be mastalgia. Mastalgia, c'est juste douleur de sein, mais la plupart des fois, bagay ça ou elle est dans petit monde qui très jeune, less than 34, most likely around 30. Et quelquefois, bagay ça peut-être stress, mais même de gain ça stress, qui doit faire ça, qui doit faire tout peut-être ou t'as joué au football ou bien whatever ça que au monde poussé et puis ou vient développer une sorte de pain c'est pas toute douleur ça se bien de questionnement de son bonne question c'est pas toute douleur qui est égale à cancer. So faites attention.
On ka dit tout à partir de l'expérience que me fait grand pile monde qui a un cancer qui pas de douleur. Douleur la vie dans dernier stage pour un pile monde. Donc, si nous on bagaille pas tant que nous autres, li pas fait mal et puis nous pas faire rien avec ça. Depuis nous sentions bagaille qui ont petit genre anormal, ouais avec docteur non.
You that are English speaking, I'm so sorry. So what we're saying is that not just because you have pain, that doesn't mean that you're committed to have cancer. It could be something benign, like just what we call nostalgia. It could also be an infection. But the most important that my sister say is that see your doctor. Otherwise, they will do, because a breast exam, a self-breast exam can be deceiving. You could think that there's nothing is there, and then they do a clinical breast exam, they detect something. Mrs. Goodwin said that, she didn't, you couldn't detect this thing until you do a mammogram. So again, like my sister said, it's very important to go and get tested. Otherwise, you miss the boat. Early detection is very important. It saves life now.
I heard that there is another examination for some of us that have dense breasts other than just the mammogram. So if you can explain.
So you miss the important, what I was mentioning before. So yes, Sister Bernadette, you can do the ultrasound, but depending on the age, less than 40, the ultrasound is a little bit more sensitive, but even less than 40, it could, we move to a plain mammogram, but sometimes we have to do an MRI mammogram, and that is very expensive. And then I mentioned before that the MRI mammogram is very specific for people with family history of breast cancer that has the BRCA1, BRCA2 genes that lead them to breast cancer, the people that had ovarian cancer, tubal cancer, peritoneal cancer that is in the cavity, somebody that had Hodgkin's lymphoma that's been on radiation, they need that. And then there's something that I didn't want to mention because I don't want to being so presumptuous. Some of us would like big breasts. In our culture, we like big breasts. So we went and go and get a lift, whatever you want to call it. So that now you commit yourself to this business and this foreign agent in your whatever, in your breast. Now, this foreign agent, some of them can develop into cancer, and sometimes when we do a plain mammogram, we cannot see anything. We need an MRI mammogram, and an MRI mammogram is very expensive. And sometimes we, as physicians, we have to go into prior authorization, justification, and that takes months.
Donc, si je vais faire un petit rapide. Donc, seulement si pour les gens qui gagnent c'est un petit genre plus dense ou bien qui gagne poitrine très généreuse, if I must say that. Mon ou gagne dense tissue. OK, pour tout le monde qui gagne dense qui gagne un tissu dense ou bien qui gagne un pile qui gagne plus espace en pile l'autre. Donc yo dit que no offense. I'm not laughing at people. Donc c'est amende si gon test qui puis efficace. Donc docteur Peggy expliqué que le ça MRI mammogram nan gen doit order li au lieu de mammogramme normal.
Bonsoir ou bien good evening. My question is that Jeanette spoke earlier about black women and white women. For the black women, it's a lack of education. They are not educated. And also, the services that are available for the white women, they are not available for the black women. I am a cancer survivor. Thank you, Jesus, I am alive. I was diagnosed with breast cancer. When the doctor told me, you know what, and so on, I said, you know what? My Savior will heal me. And God keeps his word. I went to the treatment, but God was already did his part in my body. Because the specimen they removed from my breast after the surgery, there was no cancer. God will already take care of me. And if you don't have insurance, when you go to the hospital, there are certain things they are not available for you. Jeanette spoke about many programs. I followed all my care at Boston Medical Center. Nobody ever called me and asked me how I'm doing. I did all my treatment there. They wanted me to do radiation, chemotherapy, this and that. All up to now, I have a medication that I am taking. If I didn't have insurance, I don't think they will give me that medication. It's so expensive. And they told me to take it from 5 to 10 years. For now, I've been taking that medication for about 3 years. My insurance is paying for it. Not everybody can afford for it. So when they go to the hospital, they do not have insurance. They don't offer them anything just because they are Black or Haitian especially. What do they have to do? Go home, sit down, cry, and die? Me, I didn't go home, sit down, cry, and die because I have my Savior. I have my big church. Everybody here was praying for me. They were with me, and up to now, they are with me. Not everybody has that kind of support to help them go through this process. So therefore, it's important for the health department in the church to make more programs to let the people know that there is available services for them so they can go and ask you as a representative of Boston Public Health or whatever, you have to come here and talk more about it to educate the people so they can go there and get the service that they need. Because I didn't know that you are part of breast cancer, although you are here at Temple Salem, and I am here too. We need to advocate, educate the people, because education faite chaque jour, every day. We have to remind, as a health member, remind them, ask the church to give at least a month 5 minutes, even on a Wednesday night, to talk about it. A lot of people, you see, they are not here. But a lot of them need to know the information that are available for them so they can get the services they need when they are sick. They know who to call, who to address the issue.
Donc, ce mot d'expliquer que blanc yo puis éduqué, noir yo manqué éducation effectivement, lui-même li survivre cancer et c'est pas parce que c'est plus à cause de créateur li, bon Dieu li supporte l'église là, mais c'est pas que il était informé de tout ça que nous a parlé là parce que malheureusement noirs yo et surtout haïtiennes yo pas gain information ça yo ou du moins docteur yo pas ba yo prescription yo ta supposé ba yo surtout si yo pas gain si yo pas gain assurance parce que li gain un médicament que li gain pour le prendre jusqu'à 10 ans, li gain 3 ans qu'on a depuis que la prend ni et médicament ça est très cher. Et en pile nan moun sa yo pas prescrit si yo pas connaît côté comme yo a rentrer donc si ou pas gain assurance ou pas gain même traitement. Donc li invité pour département santé en continuer faire programme ça yo pour éduquer peuple en plus pour yo gain plus information pour aider yo autrement il y a prend diagnostic là yo à la caillou yo crier mais pas gain espoir. Did I do good? Thank you.
something?
Okay,
Please,
what
my
I was
sister.
going to say, we'll talk about the different program. We need to have more programs in the community, and Black women need to get more educated. There are something that we cannot control. There are things that we cannot control. Everything is for a time. It depends of the period of the time. This program reached 2010. It was started, CDC was funded this program for 10 years. And after the 10 years, there were no funding. We used to come here to do education on breast cancer, and not only at TempleSalem, we go to other churches, and we offer people what we have based on fundings. And the program, as I said earlier, was very successful. Now, people are more educated about breast cancer, and less Black women die. And there are many testimonies about it. But I'm limited to what I say. I said, this is the program that was there that helped decrease the rate of dying from breast cancer because of late detections. I don't know if I got it straight.
Yes, you got it straight, my sister. So I want to thank you for bringing that up. And I think I miss Dr. Colette. She's not here, but she insisted that we go through with this program. That's number one. So we take it seriously. And it's going to be on YouTube and Zoom. Anybody that is listening to me, everything is in YouTube and Zoom. And we have a representative here, my sister Jeanette, that can give you some information. And if you, we got in Boston, and we have also Pastor Idris that has a broadcasting station, Idris Web, the BAM, that we can do that. And then also too, from my experience, from my report, from my presentation in 2021, in August 2021, less breast cancer deaths, not only in white women, Hispanic, Black women, less of them are dying. However, there is what we call social determinant of health, and we are getting more and more involved with that as primary care physician, because we're realizing it's not just seeing the patient, getting paid and go home, but it's a whole network. We have to look at the whole picture to be able to make a change. It's about making change. Solid change, long-lasting change that can help. The other thing is, and I don't want to get into that, some of the time, what is happening is that if you don't have if the medications is new, some of those medications, they are new. They've been there maybe 5 years or whatever years that they've been there. And there are new medications, modulators, whatever, genetic medications that are coming into the picture. So it's going to be even more costly. We can do prior authorization. But if Mohammed doesn't get to the mountain, we cannot do anything. They have to come to us. They cannot wait when it's at stage 4 to come to us because it's too late. So I do apologize to anyone. I don't mean to disrespect anybody, but we have to also, there's something called patient-centered medical home. The patient also has to take a part along with us with respect to that.
One of her questions, which I'm in agreement with, on Sabbath morning, the health department can ask the church even once a month to have a little point about health. And then they can tell the people, if they have questions, who to go to talk with. I think I agree with that. We should have a coin de santé at least once a month in the church. That way people can know a little bit about it. You don't have to go do a lot of things like we're doing tonight, but at least if they have the questions, they know who they can go and talk peacefully, and that person can direct that person to the right place where to do what to do, give some advice.
Agree 100%. My sister?
Okay. Dr. Peggy, regularly I went for my mammogram. They always write me and say, you know, we saw a dance. Okay, let's say that November I went for my mammogram. It always saw a dense tissue and things like that. It's nothing, don't worry. And next year I went back. I had the mammogram. That's the time they said, oh, they see some. They saw 3 lumps on my breast. And then now they asked me to go back. It's not like I wait until the last minute. Regularly, I went for my mammogram. It's through the mammogram that they discovered that I had 3 lumps on my left breast. And they asked me to go for biopsy and things like that. They realized that 2 of them was a cancer that was growing. And now they start saying, oh, this, that. It's not like I was sitting with not having my mammogram regularly. Yes, regularly. I went for my mammogram and follow my care.
So sometimes...
So it's important for me, again, I am reiterating what I was saying. It is important because some people, this is a big church. We might, as a community, we are responsible to educate our people too. Some people here, they are sitting here, they don't even know what is mammogram. Because by listening to other people saying, oh, it's so painful, it hurts, that's already scared the person. They need to be motivated more in order so somebody can, if somebody at church can go like the elderly, it's important for them to know this is very serious. They have to go and do it. It's good for their health. And also, if something happened, okay, we have this program or services available for you. We're going to help you with this. We're going to help you with that. They need a backup.
You've said it very well, my sister. Thank you. Yes, we need to continue to do better. Thank you. My sister?
I know the statistics for men isn't so great, but also I know most of the time when we talk about breast cancer, we tend to, most of the time, focus on the women. And like I said, the statistics for men isn't so great, but men do get breast cancer too. And I think, some effort, because I really hardly ever hear people talking about men and breast cancer. And I think it's something that we need to really focus on, because they're not the kind of people that's going to think they're going to get breast cancer. They think that it's a woman's thing, first of all, and so they would act accordingly. So, yeah.
It's my beginning of my presentation.
Oh, I missed it, sorry.
Yeah, no, it's okay. 1% of men do have it. And then I don't want to say this, we are in church, but I have to be honest. Now we have this bisexual or transsexual or transgender or whatever. They're doing a lot of hormonal thing. Those hormonal things that they are changing the sex with is the estrogen and the progesterone will predispose them to, and then they take spironolactone that cause lactation, and they think something is wrong. And so, anyway, so it's a hot mess. So now I'm forced to say, do you like men, women, bi, whatever, women and men? So I'm sorry. So I can, let me stop, he, she, or something, and even the animal too. So anyway, let me stop there. But I did address that.
But I was going to say too, this is a really good thing that you did today, and it's incumbent upon us as individuals to take our health in our hands, because sometimes you do these things and people don't show up, so they don't get the information. You know what I mean? The young lady said this is a big church, so we are the people, because this is an opportunity to get the information from medical doctor. Are you a nurse, ma'am? Yes. A gerontologist. Lots of information. But we have to, as a people, and I'm speaking for the black race because I'm black, right? We have to put ourselves out there too. Like you said, if Muhammad won't go to the mountain, then the mountain must go to Muhammad. You know, we have to take our health in our hands. And I know there are, you know, elderly people who can't make it out, or, you know, whatever the case is. But we as a people, that's the culture we were raised in. Because I'm from the Caribbean, so I could speak on, you know, Caribbean folks. We do not like to go to the doctors. We do not like to, we hear mammogram and we're running away. We hear prostate cancer. Do you know that when I got married first, I had to make every doctor's appointment for my husband? And what scared him was I said, prostate cancer is not just for older men. Young men get prostate cancer. Now the man is running to the doctor, I mean, proud as a peacock. Oh, I got my flu shot, I got my, you know. So we have to do it. You know, nobody can do it for us. We have to take responsibility, and I really applaud you for, you know, the effort, and you know, I know this is going to be ongoing. I know this is not the last one you're going to do, so it's amazing.
Donc, Pasteur Idriss encourage nous pour nous prendre contrôle santé par nous, parce que les sorties dans Caraïbes l'a expliqué que monsieur en général ou bien mon dans Caraïbes pas aimer al docteur. But c'est nous pour qui prend contrôle santé par nous pour nous faire prendre décision al docteur pour protéger tête nous. Li bay l'autre histoire de Jean-Marie li pas très bien aller chez docteur, li parle que Jean cancer prostate son bagay ou ka gagner dans jeune âge, pas nécessairement grand monde seulement qui gagne ni, et qu'on y en mariant aller chez docteur régulièrement.
En question. Qui relation qui gagne entre dos fait mal ou bien poitrine fait mal avec breast cancer? Is there a relationship between backache and chest pain with breast cancer?
So, depending on the stages, I went over the stages this morning. Earlier on, stage 0 is confined to the breast. Stage 1, 2, 2, 3 is not only in the breast, but it can go into your axilla, the supraclavicular, and some of the other lymph nodes and stuff like that. But then, sometimes, in stage 4, it's not just in the breast, it goes to the back, to the bone, so it could be in your back, okay? It can go into your liver, it can go into your lung. So when somebody comes to me in the age of 50 with family history of breast cancer, and then they're having back pain, I'm gonna go and do a mammogram, and if my plain mammogram doesn't work, I'm gonna try to do a prioritization to do an MRI mammogram on this person. But I won't quickly go into the MRI mammogram. I may take a few months before I get to that and stuff like that. And then, as a primary care physician, I may seek the opinion of an OBGYN, because, my sister, sometimes we could miss things. The mammogram in and itself is not perfect. The sensitivity of the mammogram is at best in the 80s. So, meaning like, just because you do a mammogram, that does not mean to say it's going to be 100% positive that you have something that is wrong in there. I don't know if I answer your question. So I have a question. How many of you are committed to start and not only yourself, I know a lot of you that are here are interested, but your family member, your daughter, your aunt, how many of you are going to be encouraged to, and your friends, and people in your community. You know, my brother this morning had a very nice lecture. He says that, you know, we cannot do it by ourselves. So how many of us are going to be committed to go out there and ask people, have you done your mammogram? You know, it's a group effort. Mhm. Eh,
Thank you. Breast cancer does not run in my family. I know of nobody who had breast cancer. But then my daughter at 43 was diagnosed. I have a younger daughter. What does that mean?
So it started now with your daughter. And if you see in the slide from before, like age when they get their first baby, age of monarchy, fat, their diet, all of that. It's not just family history, but those other risk factors are important. That's number one. That could have been some of the factors for your daughter to develop this thing. Now, having said that, now that your daughter has been exposed to this disease, what age was she again? Okay, so now if she has a daughter, that daughter needs to do her mammogram at the age of 33. That's what my sister was saying. 10 years before, 10 years from the diagnosis of your daughter, her daughter, your granddaughter needs to do her mammogram at the age of 33. And every other year, and she needs to do that. I would say even every year. And then one step further now, I would even say that she needs to, your daughter should probably check for the BRCA genes. Because if she has the BRCA genes, they can do, okay. So then you can do early treatment also, even in your granddaughter, if she were to be tested for that. So that way she doesn't not have to, as a prevention. Remember the first slide that I talked about? She can do that. I wouldn't suggest that she do a oophorectomy or mastectomy, but there are medications, the tamoxifen, the raloxifene, that can be done if they are tested positive for the BRCA genes. I'm talking about now your granddaughter. Early detection. No, no. I'm saying that her daughter. Okay, so what I'm saying that because of the fact that her daughter, that is 43, had this thing, she has choices. Number one, her granddaughter needs to get the mammogram at the age of 33. And then also too, she can be tested. But before she does that, they need to talk to her, do the assessment too, does she have any other risk factors? So there's not necessarily a specific age for the BRCA genes per se. What I'm trying to say is that particular daughter in her 30s now, that granddaughter has, at the age of 33, she has option number one to get a mammogram. Option number two, it should be mammogram plus the BRCA gene testing. Do you see what I'm trying to say? Because like my sister mentioned, the mammogram could be negative, especially if she's a young girl with dense breasts, probably. She may need an MRI mammogram. So with that patient, she probably would need the BRCA gene testing too, because they can do treatment if that one is positive, even if the mammogram is does it make sense what I'm saying? So for that particular case, at the age of 33, because her mother was diagnosed with breast cancer at the age of 43. I'm not saying everybody is committed to do BRCA gene at the age of 33. I'm saying in that particular scenario, she should do it at the age of 33.
Bon, me faire un petit résumé tout petit pour ça que
Excusez,
passe là,
I'm
excusez. Donc, quand Pasteur Idriss expliquait que il n'y a pas de gain aucun monde dans la famille qui te gain, il n'y a pas de gain histoire cancer dans la famille du tout, mais petite fille te gagné à 43 ans. Donc, il m'a dit docteur petite li qui le pour le tester qui ça pour le faire. Donc docteur Peggy expliquait que petite là comme maman te gagné à 43 ans, l'a besoin faire mammogramme à 33 ans avec test qui pour tester BRCA gene BRCA gene gène qui indiqué que le a gagné cancer là.
Correct. Yeah. Did you want to add something, Sister Jeanette?
I don't want to add too much. It's like I just want to compliment Ward because they detect a breast cancer because she keep doing a mammogram. You did the right thing. Now, the other thing you can do, you can encourage your family, your mother, your sisters, if they don't do mammogram regularly as you do, for them to practice, because when there is a diagnostic in the family, the risk can be very high. That's what I want to say.
So, thank you very much. So, Chantal, I don't know if we should check with Zoom to see if maybe anybody with Zoom has any question for us. Since we're going to wrap up in 20 minutes.
I did give my phone number. I knew your telephone number. For this one, I have no Wi-Fi right now, so I cannot check that. But nous avons texte 617-291-5714 si nous avons une question. Nous n'avons pas trop de temps qui reste, donc on y a ces moments si nous avons une question.
So, si nous voulons tout, nous devons relayer ce numéro de téléphone 617 901 0079 s'il y a des questions. Merci.
I've met so many people, so many Asian women with breast-related disease or family with breast cancer, and AFI has funded and designed a program for Asian Women's Health Initiative. We still have this program is alive. It was funded by Susan G. Komen. So most of the activities that I'm doing in the community, I do it under this program. And I brought some giveaways and some brochure about how to do breast self-exam. After you finish, anybody can come and grab one on the table. Thank you.
And there's also videos that can tell you how to do, everything is in YouTube now, that can tell you how to do the breast exam. No, it's interesting. We can see that there's something that's been repeating over and over. I'm so glad that I was no disrespect to anyone, especially my friends here. You know, I think I tried different religion before I became a Seventh-day Adventist, but you know, the Seventh-day Adventist diet leaves a lot of desire. You can see that obesity is one of the interesting things. I mean, it seems like obesity is connected with everything. All kinds of cancer is connected with. So if anyone that is listening that is also want to make a change, I would say one of the top change that they could do is eating the right diet, because it affects not only cancer, your heart, your, diabetes, cholesterol, and heart attack. So all of that, and including cancer. So I would encourage everybody to look into the vegetarian diet. So.
I'm doing a survey on cardiovascular disease. Anybody who wants to participate, I'm going to pass out a form. You can fill it out for me. It is about research on cardiovascular disease. And, you know, nothing can be done if we don't do research. So it is a research program that I'm working on it. And anybody that who's willing to participate, I can give you a form. You can fill it out right here for me. Thank you, Dr. Peggy.
Excuse me, Dr. Peggy. What's the people, you know? I think we should do more motivation or what? I don't know. Where are they? Where are the people?
Where are the people? Actually, there's a song like this, "We Are the People," but you say, "Where are the people?" Well, my sister, it's not about the people are in Zoom. The people have an opportunity to listen to this thing again, because it's going to be in Zoom and in the website. So we are doing our due diligence, and we hope, like Sister Bernadette said, that once we do this thing on a monthly basis, like our health corner at the church, maybe it will motivate more people to participate. So, and like I said before, that if each and every one of you that are present here, including the men, because they have wife and sisters and mothers also, and it affects men also, if they can talk to anybody and encourage them to do their regular mammogram, 40 to 49, you can start, especially if you have risk factor. Now, U.S. preventive tax force say 50 to 74, let's start it there. So I am counting on you, because I'm exhausted. I've been in first service, second service, and I'm standing here. So until 7 o'clock. So it's a group effort. So we need to be, to work together to do this. It's not about us. In Matthew, it says that we have been commissioned to help one another. We got the message, we have to pass the message. You know, I think, Pastor Idris, I think it's in John 3 John, it says that we have to be in good health, physically, above all things. Yeah. Mm-hmm.
That is the undergirding scripture for my moments with Pastor E on NECTN. I wish above all things that you prosper and be in good health as your soul prospered. So it's no longer just feeding the spiritual, because the spiritual man cannot work without the physical man being well. So we have to do all of it.
Captain de là, dans Jean 3, m'a répété ça encore, il dit, il voulait que nous toutes, non seulement nous prospérer spirituellement, mentalement, mais physiquement, nous supposons prospérer à tous égards. So, s'il te plaît, frères et sœurs, nous, Health Department, nous ne pouvons pas faire les pour compte nous. Nous, chaque là, nous avons collaboré ensemble pour nous mettre tête ensemble, charge la loup. Mais nous connaissons que si nous tous travaillons ensemble, nous résoudre un pile de bagailles. Des moun gen moun. Ok, merci. Mais, je connais si nous gagnons. Was there any message? No? Oh, okay. Okay. So, I know this is about breast cancer, but I will be remiss to say this is October, the winter month. I've been saying that in VTS, and I know that maybe some people probably want to throw a dart, but I took the COVID vaccine. I was brave. I took both of them at the same time, the COVID vaccine and the flu vaccine in my right and in my left arm. COVID in the left, the flu in the right. Brothers and sisters, we are in an interesting time. So we may have to do that COVID and flu vaccines. So I'm going to encourage, I still have people that are positive without any symptoms, not even a cough. They were exposed, they came to be tested, and they are positive. So please, we need to be more vigilant about that. And then I will also recommend, if you don't want to do it like me and take it at the same time, you can do it 1 week apart. So that will be my recommendation with respect to that. We are talking about breast cancer, but there are other cancers that we hope to discuss in the future. Like I mentioned before, breast cancer is killing, second most common cause of breast cancer in female, but lung cancer. So be careful with your children. Passive smoking is just as deadly as regular smoking. When you're smoking. So lung cancer now is number 1 on everybody, and then breast in the women. And then women, it's not breast, it's prostate, and then you have colon cancer. So we do have questions from YouTube now. I was... Okay. So Sister Jeanette, Harriet Goodwin, Mrs. Goodwin, I'm sorry, Mrs. Goodwin, Pastor Idris, and Sister Chantal, and you that are in the audience, I think we must have done a fairly decent job because there's no questions. So I think on that note, it's about 10 minutes. So I don't know. Pastor Idris, would you help us to say a prayer? What do you think, Sister Chantal? Should we say a song and then a prayer by Pastor Idris?
Merci en pile pour participation. Donc, nous allons chanter une strophe et puis faire une prière finale. 335, en couplet. Le cri de mon âme s'élève vers toi, elle te réclame,
Jésus pour son roi. Ton joug est facile, ton fardeau léger, sur mon cœur docile, règne au bon berger. Amen.
Could we all stand, please? Go ahead. Okay. Father, we thank you for this privilege of gathering together to talk about our health. As we said just recently, just previously, your word says that John said, I wish above all things that you prosper and be in good health as your soul prospereth. And so, God, help us to take care not only of the spiritual, but help us to take care of the physical, because the spiritual has to work in tandem with the physical. And so, God, we just thank you. We thank you for Dr. Mentor, Mrs. Goodwin, the nurse right here. We thank you for the knowledge that they have imparted. And we pray that, something that was said would make a difference in someone's life, understanding that we have to take care of ourselves, because if we don't, we will suffer the consequences. And help us, oh God, to be wise. You want us to be wise, and part of being wise is taking care of ourselves, because we get to pass this way once. We don't get a do-over. So help us, oh God, to take our health seriously and do what is right and do what is necessary. We just thank you. We pray a blessing on this congregation, the pastor and his wife, and all the members here, God. We thank you that in this part of the vineyard that they're doing your work, and they may just continue to educate their people about the necessity of being healthy. We give you praise, we give you honor, and we give you glory. In Jesus' name, amen.
Merci beaucoup. Passez une bonne semaine. Attendez, avant nous aller, hi, hello, come back here. Gen 2-3 souvenirs là, sur table là, nous ka passer prendre un bagay, OK? Sœur Ginette pote un pile bagay pour nous là, moi ouais foulard. Ça oui. Stickers. Gen pamphlet, gen stickers. Avancez pour nous prendre sac sur table là. Merci.